All week, we're reporting on the healthcare systems in this country and some of the critical questions that should be part of the national debate on any proposed healthcare legislation. One question certainly is just how fast are costs of healthcare rising and why? From 2000 to 2007, healthcare spending in the United States rose almost 4% per capita, the same rate as other developed nations. Another key question, just who bears the burden of healthcare costs in the United States? The federal government pays for 45% of all healthcare costs. That's far less than every other developed nation in the world, except Mexico, which also covers 45%. Private insurance accounts for just about 35% of healthcare in this country, far more than any other nation. The United States, Canada, and France are the only countries where private insurance accounts for more than 10% of spending on health care. The United Kingdom offers universal health care coverage through its National Health Service. The program is publicly funded, but the public isn't entirely happy with that system. In fact, almost 60% of Britons believe the system requires fundamental change. Kitty Pilgrim has our report.
That's good.
Go to a doctor in Britain, you won't have to pay when you leave. It's the same at the hospital. All health services are publicly funded by the National Health Service, funded by taxes. For that reason, a survey revealed only 2% of people in the UK who had a medical problem did not seek treatment because of cost. Peter Pitts of the Center for Medicine in the Public Interest, a nonpartisan research group, says the upside to the UK health system is universal coverage.
What it really delivers today in the kind of the classic British tradition of muddling through is mediocre care for everybody.
The British government sets the budget and is charged with determining what will and will not be paid for. Critics point out that cutting-edge drug treatments for Alzheimer's, cancer, and other severe conditions are often not included on the list of medicines that the government agency, known as NICE, will allow for reimbursement. Peter Pitts says it's a system that has real shortcomings.
You can either accept kind of a one-size-fits-all healthcare system, which really doesn't fit anybody all that well, which is really terrific if you're not sick or very sick. But once you have, cancer or advanced stages of lots of diseases, and you really need cutting-edge medicine, that system is really not equipped to provide it with excellence as ours is here.
Other comparisons to the United States, the UK has male life expectancy of 77 years versus the US at 75. The UK spends a lot less per capita on health care, $2,992 a year versus $7,290 in the US. And overall, the country's health budget is only 8.4% of GDP versus 16% in the US. Doctors are about as plentiful.
Now, a 2007 study found that 57% of the people in the UK said the system really needed significant overhaul. Some in the UK have decided to opt out of the national health system and pay for private medical coverage. It is available, but anyone taking on private medical care has to opt out of the national health system. So a telling point is, in the last decade, some British companies are actually offering private health care as a recruitment perk for their employees, Lou.
One of the things is becoming crystal clear here, as we have reported now on Denmark and Canada and now the UK. This is not a simple issue. And it really puts into stark contrast this idea of rushing through legislation when all of these other programs, we're only coming to terms with a broad understanding of what universal care and national health care really entails.
Yeah, even the countries that have it are still trying to adjust it to meet the needs of the people that they're trying to cover. So it really needs a lot of adjustment, a lot of tinkering, and we should not be rushing through.
This is it's fascinating and excellent reporting. Thank you, Kitty.
Thank you.
Kitty Pilgrim, and we're going to be looking next at France and its healthcare system.